Monkeypox frequently asked questions, part 2. How can I protect other people if I get monkeypox? If you have monkeypox, you need to self-isolate until you are no longer infectious. Your healthcare provider will help you decide if you should be cared for in a hospital or in your home. This will depend on how serious your symptoms are and whether you have risk factors that put you at risk for more serious symptoms, and whether you can minimize the risk of infecting anybody that you live with. If you are isolating at home, you can protect others that you live with by the following. Isolating in a separate room, using a separate bathroom, or cleaning it after each use. Cleaning frequently touched surfaces with soap and water and a household disinfectant. And avoid sweeping or vacuuming. Use separate utensils, towels, objects, electronics, and bedding. Doing your own laundry separately and putting the materials in a plastic bag before carrying them to the washing machine. Opening the windows in your home to make sure that the space is well ventilated. If you're not able to avoid being in the same room as somebody else, avoid touching, clean your hands often, cover your rash with clothing or bandages, wear a well-fitting medical mask, and open windows. Second question, why are we seeing monkeypox spread in communities of gay, bisexual, and among other men who are having sex with men? The risk of monkeypox is not limited to communities of men who are having sex with men. Anyone who has close contact with someone who is infectious is now at risk. However, the data tells us that sexual encounters between men having sex with men have played a role in transmitting monkeypox within the recent months. Some men who have sex with men are connected to a dynamic sexual network that extends across different cities or countries. This may explain why we're currently seeing cases in these communities. While the virus continues to circulate in these networks, experts and advocates are urging gay, bisexual, and other men who have sex with men to be alert to symptoms and take care of and protect themselves and others. Communities of gay, bisexual, and men who have sex with other men may have strong links with sexual health services. This has been demonstrated in the current outbreak, as cases have been identified among men coming forward to be tested inside sexual health clinics. Men who are accessing antivirals for treatment or protection of HIV infection are also receiving regular screening for sexually transmitted infections. This regular contact with their health services has enabled the identification of monkeypox within the community and is an opportunity to deliver vaccination and reaching out to those who need it. Next question. Is my risk of monkeypox higher if I am living with HIV? People with underlying immune deficiencies may be at risk of more serious illness from monkeypox. People living with HIV who know their status and have access to and properly use treatment can reach point of viral suppression. This means that their immune systems are less vulnerable to other infections that they would be without treatment. Studies are underway to better understand these questions. So far, men that are living healthily with HIV who have developed monkeypox during this outbreak have not yet reported worse health outcomes compared to others. Next question, where can I learn more about monkeypox? Find answers to some of the most common questions on monkeypox here, or read the World Health Organization's fact sheet. You can check your local, official, and community sources for updates on the situation that's near you. Many organizations supporting gay, bisexual, and other men who have sex with men, including HIV support organizations all around the world, are already providing strong leadership in offering information and support to their communities to help prevent the spread of monkeypox. Their work, also increasingly supported by broader LGBTQIA+ organizations, is central to efforts to address the stigma and discrimination, as well as information sharing. Reach out to a trusted organization in your country to get more information. If you are having sex with multiple partners, seek regular screening for sexually transmitted infections and discuss with your healthcare provider whether you would benefit from taking PrEP. Seeking health advice regularly and quickly if you have symptoms will help you get treatment if needed and avoid the possibility of infecting somebody else.